Hi, I'm Dr. Ashley LaRoche from the Animal Hospital of Statesville, and we're in the middle of a tropical storm type thing. So instead of lakeside chat, we are doing fireside chat today, so we don't get all wet. So
we thought seeing us drenched was not quite the good idea.
So we're here to talk about something that affects a lot of dogs, and we get a lot of questions about this subject, and we see a lot of dogs, with this problem, seizures. So seizures affect about 1% of the dog population. That's a huge amount of dogs. So
okay, well, what are the causes of seizures? How do they catch them or get them or?
Well, seizures are basically triggered or untriggered, very disorganized neuronal firing in the brain. So seizures are caused by a whole bunch of different things. Cancer can cause seizures, advanced kidney, liver failure can cause seizures, heat stroke can cause seizures, inflammatory diseases can cause seizures, toxins like xylitol, which is a sweetener, caffeine, chocolate, overdoses can cause seizures, certain rat poisons can cause seizures, congenital defects of the brain can cause seizures. The vast majority of seizures that we see in dogs, it's idiopathic, which means we really don't know why. So, and those dogs are classed as epilepsy, idiopathic epilepsy typically. So basically that implies recurrence as well, epilepsy. So, yeah.
Well, what are the symptoms of seizures? Can they differ? Or
they have a variety of presentations. It depends on what portion of the brain or how much of it is affected with these rapid neuronal firings. So what most people think of is a generalized seizure. That's where your dog's laying, kind of on its side, foaming at the mouth, paddling, which means, its legs are moving, it's tremoring everywhere, paddling. It's completely not aware, and just very rigid muscle contraction. And then you have the focal motors, where one little section of the motor cortex of the brain is affected, and there's kind of some negative neuronal activity going on there. So that's the dog that may or may not be alert. It depends on the dog. And they just kind of have a leg that starts shaking, or they just get really weak to where they can't stand and kind of stagger, that sort of thing. Those are much milder presentations.
So you may not even know your dog's actually having a seizure. It might be a questionable
That's correct.
behavior.
I've had a few dogs that came in that were a little older than expected that we thought had idiopathic epilepsy, and I'm suspicious they probably had some focal motor activity while the owners were at work and they never knew, kind of thing. So.
Sure. So how are seizures diagnosed? Do you have to do blood work?
So seizures, usually we are listening to what the owner's saying and what the owner describes. Videos are great if you have them. But seizures, unfortunately, can be really frustrating because idiopathic epilepsy, those dogs are normal in every capacity. So we're ruling everything out. So basically we start with some blood work. If it's an older patient, we'll maybe do some x-rays. Ultimately, an MRI and a spinal tap are needed to do the advanced disease rule outs. But the vast majority of dogs that kind of fit into the idiopathic epilepsy group, you start with some lab work, and basically the client history is so important. And of course, with the dog that comes in seizing, we obviously can recognize that. So.
Right. So how are seizures treated? I'm sure since there's so many varieties of causes.
Sure.
There must be a huge variety of treatments.
Sure. So ideally, you try to find an underlying cause. So if you have, say, a puppy that comes in that's hypoglycemic, low blood sugar, well, you can, kind of correct that problem, and that tends to be a permanent fix. The vast majority of seizures are idiopathic and they're not curable. So if we can find an underlying cause and correct it, that's great. We can do that in a few cases. And for instance, an animal that has hydrocephalus, a young dog that has a congenital brain abnormality, that's a real difficult situation to correct. So takes a lot of advanced imaging, a lot of kind of expensive surgery. So if we can find an underlying cause and correct it, 30% of the seizure dogs are idiopathic epileptic dogs. Everything's normal. So that's just kind of how they're made. So we have to control the seizures. We never really cure them. So we can control them oftentimes pretty well with medications. There's several of them out there. Phenobarbital and Keppra are the two big ones that we tend to use, but there's zonisamide and potassium bromide, and they kind of have niches. And there's some newer modalities coming out that are still undergoing in research, and they're
hopeful.
Yeah, and some of these are off the human side, and some of the newer things are kind of expensive yet, and they're not totally tested in dogs, so to speak.
So are there any alternative treatments or supplements that can help a dog with seizures?
Yeah, not necessarily, like the holistic stuff, not necessarily. And then people always ask about CBD and things like that. Well, there's no research really indicating that in the dog it's really effective, but there's not a bunch of research out there. So that may come one day. So we don't really recommend it because it's actually kind of expensive.
Can you?
Yeah, we can't,
point?
right,
Yeah.
we can't, and it's kind of expensive, and there's really no indication that it's really effective. I guess in a dog that has, any dog that has seizures or nerve disease, basically, there are a few diets that are prescription diets, and they have a high degree of medium chain fatty acids and triglycerides.
Oh, okay.
And there is some thought out there and studies out there to indicate that, they target they increase the inhibitory neurons in the brain, so just an overall leveling of brain activity may not work. But some, they're out there. There is some research to indicate that maybe they're effective, but it's definitely.
In some case, it may be worth a try.
Right, it might be.
Nothing else.
I would say it would be worth a try, but it would be not in place of medication. If the dog needs medication, it would be an adjunct to medication.
So. Number one, do cats have seizures?
Cats do have seizures. They're much more rare than dogs. Typically, they have underlying some sort of an underlying infectious disease or structural brain deformity that gives them those seizures. Okay. And we have very limited things that we can use in cats. Phenobarbital, which is very effective, but there are a few cats that kind of their liver doesn't react super well to that. It's rare, but it can happen. And Keppra's become pretty popular in cats as well. I
don't remember seeing a cat with seizures when I was teching.
It's really not common. I would say a lot of times, we're involving a toxin or hypoglycemia or like I said, an infectious disease like FIP or, kind of leukemia, something on that order, or cancer, it's usually not an idiopathic, kind of disorganized random brain firing. It's just, that's not the usual case with a cat. So.
Okay. What do I do if my pet has a seizure? How do I have to do anything to keep them safe?
Right. So if it's a seizure and you're kind of typically know the course of your dog's seizures, it's just keeping calm, keeping everything quiet, no extra stimulus in the environment like loud noises, things like that. The vast majority of seizures last a minute or less. So usually they'll start coming out of it. They do have what's called a post-ictal stage, so they're really kind of half out of it for sometimes up to 24 hours. You don't need to, kind of worry about their tongue. They're not going to swallow their tongue. They may bite it, but they're not going to swallow it. Keep your hands away from their mouth. A lot of times it's keeping you safe just because you want to comfort them and they don't know what they're doing. So sometimes they'll react in these seizure states, and the 42 teeth that they're armed with can come in contact with parts of you that in an accident. But overall, just kind of keeping things quiet. If your seizure's lasting 5 minutes or more, you probably should be heading to an emergency care facility. Okay. Just because the longer they're in that seizure, the more damage is done to that brain, and you're running closer to a condition called status epilepticus, where they just don't come out of that seizure, and it takes rather heroic measures to try and break the cycle, and some of those dogs don't come home, unfortunately. It can be fatal. So
So you answered the next question, was how long do seizures last? So usually about a minute
or less.
If they're more than 5 or
Yep.
5 or 4?
More
or?
than 5, yeah, more
Okay.
than 5. And I would say the first
Get help.
seizure like that your dog ever has, it's worth getting him in that day and just having him looked at, even if they kind of come out of it and they're normal. I feel like an exam, baseline blood work on that day is what I'm going to recommend. And then looking at the age of the dog to see kind of where it fits in the seizure diagnostics. If I have a dog that's 9 or 10, I'm going to worry more about insidious causes. If I have a dog that's 2, I'm playing the odds, and it's probably idiopathic epilepsy. So, yeah.
Okay. So what is the difference between tremors and a seizure?
So seizure is, like I said, just brain activity as far as the forebrain, it's the front of the brain. So tremors are just kind of some muscle twitching. The pet's almost always alert. A lot of times that's associated with the cerebellum, the back part of the brain.
And it's not them having doggy dreams or anything like that. It's anything like that is pretty normal.
Yeah, no, it's like Parkinson's in humans. So you're just and as they move forward or get excited, they tremor a little bit more.
Okay.
And fear can cause kind of tremors in some dogs too.
Sure.
Yeah.
The Chihuahuas, you just see them shaking.
Yeah.
They're not having a seizure. They're just scared to death of everything.
Yeah, seizures they definitely have really strong muscle contraction, and they're definitely, most dogs are really centrally dull as well.
And they don't always fall over.
No.
Some of them can just can't they just kind of go into like a stare?
They go into a trance.
Where they just,
I think they call that petit mal in humans, but yeah, they just kind of phase out, kind of, so to speak. So seizure activity, like anything in the forebrain, usually you're not mentally appropriate. So most seizure dogs are not mentally appropriate. So
okay. So what can trigger seizures? Is it food? Is it noises? Is it events? Is it?
Yeah. So sometimes there is absolutely no trigger. It's just completely random. And the more seizures you have, and you're not super well controlled, the more you have, the more your brain wants to have. So your seizure threshold starts decreasing for sure. I think they call it mirroring. So other sections of your brain will want to have seizures. But anecdotally, there are some triggers. So I always tell owners to keep a seizure log. What time of day did it happen? What time of day? What was the weather like? How close was it to feeding? How close was it after sleeping? Because I feel like I do see a lot of patients. People tell me that it's in the sleep cycle. They wake up with them. So not that you can stop your dog from sleeping to have a seizure, but there are a few predictable incidents. I think stress can play a role in some dogs, not all dogs, but some dogs. We do have a few dogs that when they hit our front door, that'll trigger them to want to seizure. So then we have to do something. That's the only time that they seizure. So we do something different. We do things out in the car, or have them come through a different door, like a side door where it's a little bit quieter. I've had owners tell me that their stress in the household will sometimes trigger a seizure. Yeah. So are there triggers? There can be. I think a lot of times there really isn't. It's pretty random though.
Okay. So I think you've mentioned, how do I know that a seizure is serious if it lasts over 5 minutes?
Mm-hmm.
When is it an emergency?
If it's 5 minutes or more, you need to call and head in to get the dog looked at, because basically that's going to take time. So basically by the time you get in and stuff, it's going to have elapsed a lot more time than that.
Sure.
So if we need to intervene to stop a seizure cycle, we want to do it sooner, not later, as well. And then if the dog's had more than 2 seizures in a 24-hour period, that dog needs to really be seen in that day, because clustering is another one of those more dangerous situations, and that's why we call that clustering.
And that answered my next question. So should I take my pet to the vet if he has a seizure? And you said maybe one, it's good to take them to see if we can figure out the cause of it.
Right.
And if they have more than one, or it's lasting over 5 minutes.
Yeah, right.
In a day.
And long, violent seizures, I think, really warrant to be seen for sure.
Even if that's the first one they've ever had, it's good.
Absolutely.
But it's not an emergency. If they've had a seizure, you make an appointment and you come in.
That's right. Especially if they're, like I have dogs that only have like two in a year, and they last like 30 seconds a piece. Well, the owners kind of know they can predict what's going to happen, and kind of are able to manage that and don't get too alarmed. But if at any time you are alarmed, you can always come in. So if there's any concerns or any questions at all, you should probably have the dog seen. But there are times they're like, well, he just has these minor little episodes, or they're focal motor seizures. They just kind of have a leg tremor and they phase out, and kind of then they're fine. Put it in your seizure log, and if you feel like the dog's doing fine afterwards, fine.
It's always better though to have that reassurance that no, everything's fine, or no, we need to work up things further, and you don't want to have those regrets as, man, I should have taken him in.
Right. That's
because like at 6:05.
Yeah, that's right. That's right.
So can seizures be fatal?
They can. If they go into status epilepticus and we cannot break that cycle, every drug we use to try and break that cycle on an emergency basis, their prognosis for survival goes down. Basically, their body temperature goes up, their brain is all fat, it's melting with the body temperature, but also their brain neuronally is like on fire. It's just firing, and it has trouble just coming out of that state. So they literally kind of have a brain fry, so to speak. So, so yes, that can be fatal. Or they become comatose, and don't ever come out of it. So then it becomes kind of a palliative therapy situation. So
can I prevent seizures in my pet? I mean, obviously medication helps prevent them, but is there something that you can do in your life to make sure your dogs don't have seizures? I don't think that's possible.
Not necessarily. Besides, good medical care, there are certain breeds that are kind of known to have seizures in their lines.
We've done this a long time because I knew she was going to ask her that question, and she knew it.
So, for instance, some of the herding breeds, the Australian Shepherd comes to mind. They have a higher risk for seizures. The K-Hound has a higher risk for seizures, and not all of them do, but you can see it in lines and things like that. They're working extensively on trying to figure out the modes of inheritance and genetic testing. It's just not quite there yet. But that might be something you would investigate with your breeder and see
if there's any history.
Yeah, if there's a history of seizures, that might be very important to you. Some of the genetically prone breeds don't control very well, and that can be something some owners just don't even want to deal with on the front end. So,
are Huskies one of them? It seems like I've seen them in Huskies as well.
Absolutely, and I think Labs and Retrievers, like I said, 1% of the dog population are affected by a seizure disorder, and 30% of those, it's idiopathic epilepsy, and it's kind of everywhere,
Yeah. Well, and you've got some dogs that are more a percentage of the population, so
that's right.
That can up that. So, are seizures serious in a senior pet?
Yeah, I would say a senior pet. So over the age of 6 years old, if a pet suddenly starts seizing, so this could be a dog that had minor seizures the owner didn't know about when it was younger, but typically above 6 years old, the chances of it, or the pendulum swings to a more insidious cause, and you're looking at inflammatory brain disorders, or cancer, unfortunately, brain tumors and things like that. So those patients, I'm usually talking to owners pretty quickly about maybe having an MRI done, if they can do so.
And does epilepsy get worse with age as they get older?
Not necessarily.
That's good.
There are a few dogs that'll outgrow their epilepsy. So basically, if they've went a year seizure-free, sometimes we'll talk about weaning off medications. They have to be a good year or longer seizure-free before we even entertain that. And if they're controlled well, they tend to live kind of normal lives. The dogs that don't control well, we're adding medication after medication, and we're still not controlling them. I think their prognosis for living a normal life length is decreased in those cases. But thank God we don't have that many of them. Goodness, we don't have that many of those. Yeah.
So how often if I have a pet that has seizures, how often should he be seen by a veterinarian?
Yeah, so like we recommend for all pets, twice yearly. Certain medications that we put these guys on to control their epilepsy require sometimes monitoring right after to look at blood levels and stuff. So those patients, if I just start a dog on phenobarbital, for instance, I'm going to have them in a month later, sometimes another month later, just depending on how they're controlling and how often I have to change the meds. But typically, once we get them controlled, twice yearly, just like everybody. And then we recommend blood work on all pets once a year, so they're going to get that as well. So.
And you mentioned this earlier, how to track a pet seizure activity on a calendar or whatever, and just write how long did it last, when did it occur, what time of day,
what was the presentation,
activity,
what was the presentation, that sort of thing. How close was it to eating, how close was it to sleeping, keep a little notebook, and you can track and see, because I think sometimes we get busy and forget, have we had one in 6 months, or right. So it allows you to kind of look back and see, and sometimes you can see a pattern. It's rare that you can find a trigger and eliminate it. That's usually not the case, but sometimes. So
I think it kind of helps you see progress or lack thereof.
Yeah, that's right. That's right.
So
yeah, that's right.
So how do I give my pet seizure medication? Are there side effects with the medication?
Yeah. There are varying side effects, and for the most part, the general side effect on all of them tends to be when you initially start it, they're kind of a little dull mentation. These medications are increasing the inhibitory neurotransmitters in your brain, so it kind of makes you kind of a little dull. Humans.
So not sedate, but maybe just kind of a little out of it.
Hazed out. Yeah, hazed out.
Hazy. Yes.
Yeah, and that goes away typically after a few days. It's like humans when they first start a serotonin reuptake inhibitor like Prozac or something, feel the same way. Usually, and then they all kind of have a little different ticks, but some dogs will drink a lot of water, say on phenobarbital. Some dogs will want to eat more, and then
they gotta watch their weight. Right. You gotta take them out more often.
Yeah, and some of the medications interact with other medications, so we've always got to be watching for that. So they do have a few side effects. Overall, though, they're pretty minor, and basically the quality of life that we give dogs by controlling their seizures far outweighs the medication risks as well. So,
and I kind of threw this in on you. Are there still heartworm medications that a dog with seizures should not take?
Heartworm medications, no.
So they're all safe.
Yeah, they're all safe. They're all safe. Flea and tick products, that's a different discussion, but
yeah.
Okay. For the most part, they're all safe as well.
So are the medications pill form? Are they liquid, injectable?
It depends. Yeah, it depends on, if we're just maintaining a dog, almost all of them are by mouth and they're pills typically. Of course, on the emergency setting, we have injections and things like that we use, like midazolam and Valium and things like that. But most of them are oral. I think that the compounding pharmacies have gotten really good. You can get some of them probably compounded into liquids. I think phenobarbital we can do a pediatric liquid and things like that. So, but for the most part, they're all oral.
Chicken flavor, tuna flavor.
Yeah, that's right. That's right.
Cherry.
Yeah, and the only one like Keppra has a sustained release. So, and that's twice daily, but you can't break the tab or anything, so you can't compound that into a liquid. But yeah.
Yeah. So, I think you answered this as well. Seizures in dogs cannot be cured. They are managed usually.
Yeah, they're managed. It's typically a management disease. Idiopathic epilepsy is a management disease. So.
And some of them may have one seizure and never have a known seizure again, or never have a seizure again.
That's right. That's right. We have lots of alerts on records because we always put an alert on the record, so we know that this dog has had seizures in the past because it guides us with our medication choices in that particular patient. And I'll ask an owner, when was his last seizure? And he's like, 5 years ago. So you will
That's
see
a good
that.
case scenario.
That's a very good case scenario. You will see that. We get aggressive about starting medication early if I have a dog that's clustering. So you got more than 2 seizures in a 24-hour period. A dog that's having more than 1 seizure in 3 months, those dogs get started. Horrible violent seizures get started right away. And if you're a brachycephalic breed,
that's a smush nose that we talked about on our lakeside.
You don't breathe well. Seizures are a little more fatal for you than for some of the others. So we'll start typically, unless it's a really minor focal motor seizure, and I'm having a discussion with the owner. Typically, those are getting started sooner than later. Yeah.
Okay. And pets with seizures can have a normal life.
Oh, yeah.
If their seizures are controlled.
That's
and
right.
They're on medication or
Right,
just-
right. And I feel like in general, the ones that don't control real well tend to be kind of breed represented, that just, that breed notoriously kind of has a bad kind of epilepsy that doesn't control very well. Those are the ones we kind of look at. But the vast majority of dogs, I mean, we treat a lot of seizure patients. Most of them control reasonably well to have a good quality of life as well and live a normal life as well.
So a lot of it is the owners making sure that they medicate the dog on a regular
Compliance,
basis.
absolutely.
And
Compliance.
just observe the dog and keep track of things. So.
Yeah, absolutely. So,
Well,
yeah.
anything else you've got in your notes that we need to go over that I didn't ask questions about?
No, I think we've covered it all. So, yeah. No, I think so.
Sounds good.
Yeah, I think we got it.
Okay.
Alrighty, cool.
Well, that ends our talk on seizure, our first Fireside talk of the season. And who knows, we may go Lakeside next month and
Yeah.
back to fire in November.
Yeah.
It just depends on the weather. So,
Yeah.
But thank you for listening. And
Yes, give us a call if you have any questions about seizures.
yes, definitely. All right.
Bye.
Thanks. Bye.